morning, everyone. Today, I would like to present our work on the Petrous compartmental anatomy. It's a new approach just to explain the anatomy of the Petrous pyramid. So the study of the temporal bone is a little bit complex because it has a complex composition and shape, and also has a large number of contents of bones, air cells, foramina, canals, surface landmarks, spaces, muscles, and neural elements, and vascular elements as well. This is a classical view of the temporal bone from the book of Rotten. So, So this is a classical view. This is the lateral view of the skull, of the temporal bone. This is the medial view, an inferior view of the temporal bone and skull base, and also the superior view right here. So the Petrous pyramid is a region that separates the middle and the posterior cranial fossa. They are separate. It's a pyramid shape that is, and this the ridge, the Petrous ridge, that separates the middle and posterior cranial fossa. So to simplify the anatomy of each of this region would be of paramount importance to every skull-based surgeon and to young residents as well. This is a view of the Giza pyramid. So it has 4 lateral surfaces and a base. On contrary to the Petrous pyramid that has a superior surface, posterior surface, and inferior surface facing the neck, and it has a base facing laterally. This is a pyramid with 3 surfaces. It has lost its tip to allow the passage of the carotid, so this is a foramen lacerum. And now it's in anatomical position, so this is the superior surface facing the middle fossa and the posterior surface facing the posterior fossa. So our aim of work is to develop a new pedagogic tool, something to aid everyone to learn anatomy of this part as an introduction that is simple, holistic, and to be integrated into clinical applications. So to create a mental map in place on which you are going to add every details. So first we started with a cadaver dissection in anatomy lab in Lyon University in France. We had the surface exposure of dry bones and also drilling of the superior surface of the Petrous. And then we have grouped all the contents into 4 compartments or 4 groups. So the anterior limit of the Petrous pyramid, we used the definition of rebus. So we used this point, the pre-auricular point, just anterior to the tragus. As the anterior limit, it faces medially normally the dorsum celli on the medial side. So this is after dissection of the superior Petrous surface, all the elements are exposed. These are the elements. We have the roof of the TMJ, temporomandibular joint. This is the roof of the external auditory canal, the facial nerve on all its segment, the internal carotid artery, the Petrous apex, and other parts of the neural compartment. This is with color code. So the Petrous pyramid, we can explain it as being made of 2 parts. It's a container, a pyramid that's covered with cortical bone, and there are contents that connected to the outside part. So this is a superior view. First, we start with the mucosal compartment. So it's mucus-lined extension of the pharynx in the midline. It's composed of the Eustachian tube, the middle ear, and then the mastoid antrum posteriorly. Then we have more laterally the cutaneous compartment. It's lined with the skin coming from the lateral surface to meet the middle ear at the tympanic membrane. We have here the neural compartment in blue. So this is part of what we call the otic capsule. It's very hard bone, composed of the internal auditory canal, separating the anterior labyrinth, cochlea, and the posterior labyrinth, vestibule, and semicircular canals. And the last compartment is the vascular compartment, including the internal carotid artery as it penetrates the skull surface, from the skull base from the inferior surface, then passing medially, anteromedially to go into the foramen lacerum, towards the foramen lacerum. So we define this axis as the mucosal axis, including the Eustachian tube, middle ear, and the mastoid antrum. This is our anterior-posterior axis of work. Using this understanding, we can now segment the Petrous pyramid into 4 spaces like this. So this is what we call the X method. So it's made of 2 lines in the shape of X, mucosal line right here, another line made by the external and internal auditory canals. So using these 2 lines as the letter X, we are going to have 4 spaces. The anterolateral space is the roof of the temporomandibular joint. Posterolateral is the lateral part of the mastoid. Posteromedial is the medial part of the mastoid and the posterior labyrinth, the posterior part of the otic capsule. And then we have the anteromedial compartment that has the internal carotid artery inside the Petrous apex, and has also the cochlea or anterior labyrinth anteriorly. Another method of segmentation is the V method. We are going to use only the mucosal line. We have 5 segments that are going to gather around it in a letter, like a letter V. So we have the temporomandibular joint segment, external auditory canal segment, mastoid segment is a triangle in the tip, otic capsule segment, including all the inner ear structures, and the Petrous apex segment, including the carotid. For applications, first we can start by learning anatomy on the CT scan. So first we have the air-lined mucosal line, Eustachian tube, middle ear, and the mastoid antrum. Then we add the temporomandibular joint anterolaterally, the external auditory canal, lateral to the middle ear. Now they have the components of the otic capsule, the internal auditory canal, the anterior labyrinth, posterior labyrinth. This is the vestibule, and this is part of the semicircular canal, the conchorus. Now we can add medial to the Eustachian tube is going to be the internal carotid artery inside the Petrous apex. This is a sagittal view that has been cut to be parallel to the line of the mucosal axis. So we have here the Eustachian tube, the middle ear, mastoid and antrum, and the mastoid antrum posteriorly. And this is the ice cream cone of the ossicles, and the tensor tympani above the Eustachian tube. You can also explain to junior doctors and to students what is the relations of the middle ear. So anterolateral is the TMJ, laterally is the external auditory canal, posterior is the mastoid and the facial, mastoid part of the facial. Medially is the otic capsule segment that is going to make imprints on the medial wall of the middle ear. The cochlea, making medially the promontory. The vestibule connected to the middle ear with by the round and oval windows. And the lateral semicircular canal also is going to make an imprint on the medial wall of the middle ear. And now moving to the facial nerve, this is the internal auditory canal. This part, glistening part, is the lateral semicircular canal. First is the medial segment inside the internal auditory canal, labyrinthine segment, geniculate ganglion that is very near to the surface of the petrous. And then it's going to turn posteriorly. First, it's going to lie lateral to the vestibule, and then it's going to lie below the lateral semicircular canal to continue posteriorly to dive down as the mastoid segment going into the stylomastoid foramen. These are the branches, the GSPN. It's also parallel to the axis, to the mucosal axis. The nerve stapedius and the chorda tympani lying on the lateral wall of the middle ear. This is a CT cut of the axial cut. We have superimposed on it the position of the segments of the facial nerve and the branch, but you cannot see all these branches in the same view. It's impossible because they have different orientation. Here is a cut that has been made parallel on the same line as this axis of the facial nerve. So here, this is the carotid inside the petrous pyramid. The geniculate ganglion is here. This is the tympanic segment lying below the lateral semicircular canal, turning down as a mastoid segment. We can also use it to explain the position of air cells. So we have 5 groups, just like the V method: TMG roof cells, external auditory canal roof cells, mastoid air cells that can be subdivided into 7 groups, perilabyrinthine cells that can be around and across the otic capsule, and also the prelabyrinthine or apical cells that lie anterior to the otic capsule. Another important group is the peritubal group, including lateral, medial, superior, and inferior peritubal cells. The medial peritubal cells separates the Eustachian tube from the internal carotid artery. We have also what we call accessory air cells that extend outside the pyramid into the squamous part and other parts, sometimes even into the occipital bone itself. It's important to know the position of all these cells and to identify them on images because they are pathways for disease extension, for your surgical corridor, and also for CSF leak. So you need to handle them carefully. This is a table of the proposed nomenclature for the air cells that we have just described. Thank you.